All right, next up, I have the pleasure, I'm so excited to introduce you to Reva, who is going to talk to us about Lessonbee.
Thank you very much. I'm Reva McPollom. I'm the founder and CEO of Lessonbee. And I'm a Black woman. I'm about 5'9", 39 years old, thin, I think. Long, dark locks, dark almond-shaped eyes. I'm wearing today a black top with lace sleeves, a green skirt, and red lipstick. I'm going to tell you about my company, Lessonbee. We are driving health equity through adaptive and personalized health education for students in grades K to 12. And our starting point was to replace the outdated health education materials in use by teachers and classrooms across the country with a modern learning experience. But since 2018, thanks to the ongoing support and feedback from our customers, we're transforming much more than that. We're on a mission to eliminate health illiteracy in this generation. National health education standards call for 80 hours of health instruction per student per year in grades K to 12, and that includes mental health education. But on average, get fewer than 10. Meanwhile, 50% of mental health challenges begin by the age of 14 and 75% by the age of 24. Now, this matters to me because when I was in high school, my struggles with mental health left me socially isolated, and the trauma from this isolation left me emotionally and physically scarred as I turned to self-harm as a coping mechanism. But one day, a guidance counselor introduced me to the A World of Difference program, and through this program, I would facilitate diversity workshops with other students. And as I led these sessions, I witnessed the impact of diversity promotion on student confidence and connection, and I improved my own social emotional skills. But it all came tumbling down the day that I learned that the teacher who led the program had been having a sexual affair with a student in it, and the program was terminated. And so I realized something as a result of this. I realized that it's not enough to promote diversity or social emotional learning in isolation if we want to keep all kids safe and healthy. It's the coming together of these in the context of health that can transform outcomes in the era of wellness. With advances in device access and connectivity led by Verizon and its game-changing 5G network, Lessonbee can be delivered anywhere. Our starting point is the 57 million K-12 students in the United States, whether they're accessing it through a teacher using Lessonbee with a classroom, a guidance counselor using Lessonbee to support individual need, a parent using Lessonbee to connect better with their kids, or a student using Lessonbee independently. Our solution ensures that no child is left behind when it comes to health education. But what's truly unique is our Health IQ dashboard, which combines students' self-ratings, their knowledge and skills assessments, their wellness check-ins, with CDC benchmarks and AI-generated feedback to finally connect the dots between what students learn and how they feel. In the era of wellness, there's nothing else like Lessonbee, but I'm going to let our customers speak for us.
Lessonbee is that thing for health. You just are. I did my homework before the pandemic to look for something like you. There is nothing out like you. But I'm telling you, I do my homework on what's the next best innovative thing. And you're it. Like, I don't know what there's, I don't even know anything else out there like it. I'm not joking. This is where wellness and class is going for this generation of kid. If you're not on board with this, like, I don't know why you don't have it. This is the wave of wellness, and this is how you get it across to kids. And those of you that have like classes where you got to teach PE and health, like this is the solution to that. That's why I want you to understand the why. There's nothing else out.
Based on what you've heard so far, do you know anyone that could benefit from Lessonbee? Just by a show of hands. That's pretty good. All right. Well, teachers love our solution, and kids do too. Since 2018, we have delivered over 100,000 hours of learning across 11 states to thousands of kids, helping them feel more confident, connected, and prepared to navigate life. Our business model is simple: software as a service. It's an annual subscription. We sell primarily to schools and districts. We have a freemium approach that allows for bottom-up teacher adoption, and then affordable plans for classrooms up to multi-site networks. Our double bottom line is income and impact. We're raising $3 million to impact 500,000 lives, to advance our education sales motion, to invest in our technology, to develop and deliver more content and explore new markets. The path to Lessonbee has been a lifelong journey for me. And I tell my personal story not because I think it's unique, but because I know we all have one. I mean, don't you wish you had something like Lessonbee when you were a kid? Everyone on my team feels the same way. And that's why, in addition to being incredibly talented artists and educators and engineers and developers with experience across media, healthcare, IT, and more, in addition to having the right skill set, they have the right mindset and the right values to achieve our mission of eliminating health illiteracy in this generation. So if you want to learn more about what we're up to, partner with us, invest in Lessonbee, you can reach me at Reva, that's R-E-V-A, at lessonbee.com, lessonbee.com, or scan the QR code to connect with me on LinkedIn. Thank you all so much for your time.
Reva and her team are doing amazing work.